Hello, I'm Tamara King, Richland Library's Community Relations Director. Thank you for joining us. I will serve as a moderator for tonight's call. Over the next hour, we plan to provide valuable information and resources to help the county's senior citizens and those caring for them protect and advocate for themselves during the COVID-19 pandemic. This is a town hall, so please, if you would like to ask a question anytime during this meeting, press 0 on your telephone keypad to be connected to a staff member who will note your name and question and place you in a queue to ask questions live. Let's get started. Joining us on tonight's call is Andrew Boozer, Executive Director of Senior Resources. We also have Patrick Cobb, he's the Associate State Director for AARP South Carolina. Sheriff Leon Lott with the Richland County Sheriff's Department is on the call. And Dr. Jonathan Kenoke, South Carolina Department of Health and Environmental Control, will also be joining us later on. So let's begin. The spread of COVID-19 is causing many major changes in our community, from how we go about our daily tasks, like going to the grocery store, to socially distancing in our own families, and seniors have been especially impacted during this time. Tonight, we will ask experts about the latest health impacts related to the health crisis, family caregiving needs, and what you can do to stay safe from scams and fraud during these turbulent times. This is your opportunity to learn, ask questions, and get answers from our leading experts. To talk more about this and how his organization is helping during this time is Andrew Boozer with Senior Resources. Their Senior Emergency Nutrition Program has served more than 62,000 meals since March. Andrew, thank you so much for joining us.
Thank you, Tamara. I appreciate the opportunity and look forward to lively conversation.
Definitely. So tell us a little bit about the Emergency Nutrition Program and where it stands and what's next for your organization.
Yeah, so Senior Resources provides Meals on Wheels service and other supportive services across Richland County for senior citizens that are in need. We found in March, as COVID reached South Carolina, that our food insecurity phone calls increased sixfold in a 1-week period. And it was beyond the capacity that our Meals on Wheels service could operate. And so we enacted quickly with the support of folks like the City of Columbia and Richland County Council, moved quickly to enable us to open 12 drive-through meal sites, the Emergency Senior Nutrition Program, that are in every community in Richland County and have been operating full speed 3 days a week since March 23rd. And so we've been honored to serve seniors, anybody over the age of 60 and a resident of Richland County has been able to come to these sites and receive 5 meals that are fully prepared by a local caterer, Southern Way Catering. And so those dollars have helped the food service industry here in Richland County as well, and keeping their staff employed through this crisis, and provide meals for the seniors or for their caretakers that need a little help right now, because it was and still is dangerous for seniors to be out in public, to go to the grocery store. Many seniors are on fixed incomes, and so takeout and increased grocery prices were really putting a pinch and continue to put a pinch on senior citizens. And so this has been a direct response. It's been an amazing partnership with a lot of people. And so we've been honored to be a part of that. We haven't done it alone. Big thanks to Richland County Library. 9 of our 12 sites are located in library parking lots. And so appreciate Melanie and Tamara and the whole team supporting that. Sheriff Lott and his deputies have really helped not only control the traffic that has resulted in serving these many seniors, but also have pitched in and actually helping distribute the food. And so we really appreciate that. And a lot of other volunteers and community partners have made it possible. We're projecting we're going to serve well over 120,000 meals by the time this wraps up, which is predicted. We're planning to end this on Friday, June the 5th, will be our last full operation of the Senior Nutrition Program. So if there are those listening in right now that are in need of food, go to the Senior Resources website. You can see those meal distribution sites. We're actually going to have 4 of those tomorrow morning. So I encourage you to come and to come early to those locations. We are not going to be open on Monday for Memorial Day, but we'll be back at it on Wednesday. So please take a minute. If you need some food, or that could be a resource for you, or if you're a caretaker for another senior citizen, you can pick it up on their behalf. But go to Senior Resources and check that out. We're expecting coming out of this that food is still going to be a real necessity for a lot of seniors. So we're developing our plans for the summer so that we can ramp up our capacity for Meals on Wheels and other programs. There'll be announcements coming out in the coming weeks on that. But we're fully expecting our Meals on Wheels program to more than double what pre-COVID levels were. And so that's a significant undertaking. It's going to take a lot of resources, but we want to make sure seniors who need food and can stay healthy and independent are able to do that and out of the healthcare system and out of long-term care facilities. So we've really been focused on that and working towards it. There are a few other things I want to mention just real quick, Tamara, before we go on to Patrick. We do have a program we've launched with the Department of Social Services. This is a statewide program, but we're in charge of it here in Richland County. Is the Senior Nutrition Farmers Market program, where seniors over the age of 60, there is an income qualification, can receive a $25 voucher to spend on local fresh produce and vegetables and local farmers markets through the fall. And so if anybody's interested in that, the deadline to apply for those funds is May 25th, so it's coming up very quickly. And you go to the DSS website, you'll see the link there on their homepage to register for that. It is first come, first serve. There are only 1,000 vouchers for Richland County, so act quickly. There are some still available, is my understanding, so please act quickly. And then those vouchers will be distributed through Senior Resources in mid-June. So you can expect, if you qualify, to get more information on picking up those vouchers, and you can use that throughout the summer months and into the fall at local farmers markets. And then we're also preparing to get to more normal everyday operations at Senior Resources and reopening our senior centers as it becomes safe, restarting our home care program and companion programs where seniors can have people come into their home, help them with light housework, be a companion for an hour or two to check in. It can be a real relief for caretakers that need an extra hand around the house for their senior citizen, their loved one. And also our transportation programs to get seniors to and from essential shopping and non-emergency medical. And those programs will get back to a more normal procedure as the summer goes on and as the economy opens up and as it becomes safe to do so. So keep posted to our Facebook channels is the best way to hear about those. And also for those seniors that are looking to stay active, we paused in large part our volunteer opportunities in the middle of COVID, but we are already actively planning on how we can safely reinstate those over the summer months. So if you're interested in being a Meals on Wheels driver or checking in and doing a companion visit with another senior citizen in the area, we are actively planning to get those systems back up and running this summer. So we're really excited to be able to do that. We're being cautious, and safety is the number one priority for our seniors that we serve, but also for our volunteers and employees. So as we get those pieces in place, just stay tuned, and we've got lots of opportunities that people can get involved. So Tamara, that's where we are today. That's what we've been up to and what we see on the horizon.
Thank you so much, Andrew, for that overview. You guys have been doing tremendous work. Are there any other resources or anything you've kind of been thinking that seniors have been asking you questions about that you really want to put out there? I know the emergency nutrition program and Meals on Wheels is really important and essential right now, but are there any other resources for seniors that they should be thinking about?
Yes, of course, meals and taking care of that is the first piece, but also we continue to get requests for transportation. We know, particularly in some areas of the county, that is very difficult to just get to a local grocery store or to the pharmacy. And there's opportunities both at Senior Resources. The AARP has some programs. I'm sure Patrick can speak to that. And also with the Comet to be able to make transportation accessible to senior citizens. That's a key piece to be safe and to be healthy. Also, make sure senior citizens have masks. And there have been a number of initiatives around the county, and Richland County Council and some local churches have really been actively making sure seniors have the ability to have face coverings. So if you are on public transportation or as you visit the grocery store, that you're protecting yourself and others around you by wearing a mask. And so we're actively trying to find ways to get more of those things and out in the community and resources. So if you don't have one of those, I encourage you to reach out to some of those partners that I've mentioned, or to give us a call at Senior Resources, and we can connect you with partners that we know about in the community.
Thank you so much. We appreciate that overview, and we'll be taking questions in about 10 minutes or so after AARP has a chance to speak. So thank you, Andrew, for that. For those of you who are just joining us, my name is Tamara King, and I'm with Richland Library, and you are listening to a town hall meeting where we're having an important discussion for seniors and their caregivers during the COVID-19 crisis. If you would like to ask a question, like I said, press 0 on your telephone keypad now, and you will be connected to a staff person, and you can ask your question, and you'll be placed in a queue. Next, we will hear from Patrick Cobb. He is from AARP in South Carolina. Patrick, thank you so much for joining us.
Thank you for the invitation. Glad to be with our friends from Richland Library. You guys do such great programs and projects in the community, and such a great stakeholder in this community. We appreciate it.
The feeling is mutual. What are some things that seniors need to know? I know that Andrew gave a wonderful overview of what they're doing in Richland County, but even statewide, and some things that I think a lot of seniors are thinking about. This has happened to seniors that I know, about scams and things that are happening right now, and fraud alerts that are happening for our seniors. How can they protect themselves from people trying to take advantage during this time?
Sure. It's really a shame that crime never goes away. And I've coined the phrase that scam is a 4-letter word. And right now we're still seeing folks who are being victimized by frauds and scams. And part of that comes out of the passage of the CARES Act that was passed by Congress and signed into law the first part of April, that allowed the federal government to send every citizen a $1,200 stimulus check. And so you're getting money in the mail, and some folks have probably received those checks either through direct deposit, they've received a paper check, or they soon will receive one from the federal government. First of all, you don't have to claim taxes on that federal money. It's a gift from the federal government to help stimulate the economy. But what happens is, as we all know, our older citizens are usually a little more susceptible to frauds and scams. And, the thing is, the IRS will never call you. Social Security will never call you. So you want to make sure that you want to protect your money in your bank account when you receive that check or that deposit. Everyone, even if you didn't have to file taxes, you will receive a check. You won't have to apply. You would not have to apply for any special paperwork or file a tax return in order to receive that one-time stimulus check. So be careful and be on the lookout for that. And also, I believe the IRS is sending a letter when they deposit your check, or you actually get a paper check. And I was reading earlier this week that the IRS in some areas of the country, and I don't know if this is happening in South Carolina, that they're starting to issue debit cards to folks that they can use as actual debit card, or they can transfer the funds into their bank account without fees and penalties. So those are some things there, but to be on the lookout. But the IRS will never call you, Social Security never call you. But here's a real interesting fact, and it's happened to me. Was I received a call on my phone, and it came up as spam, and I just answered it just to see who was calling it. Well, it was a young lady from the U.S. Census Bureau, and I was going through my questions. I was asking her, why are you calling me? The federal government agencies don't call. Well, she explained because of COVID, they are not putting field workers out, going door to door following up on census. So the Census Bureau may call you and follow up with a questionnaire just for some clarification or things. So be mindful. Just don't ever give out your personal information, Social Security numbers, those kind of things. And we know how folks like to answer the phone and talk to someone, but fraud just doesn't take a holiday. And I'm sure Sheriff Lott can expand on how things, what they've seen there across the ways. But it's just been a really, really tough time for a lot of folks. And, and the word that we've learned too in our organization is we have to pivot. How do we pivot from doing the day-to-day work that we've normally done from our tax aid sites that have closed down, our events we've not done in-person events now, and probably won't do them for at least another month or so. How do we pivot in this new world of this virtual world of online learning and people? And I think one of the things that we hopefully will see out of some of the CARES Act money, and I think the library would love to know this, is the expansion of broadband in South Carolina, some of the rural parts of South Carolina, because it's not just folks who are doing homeschooling, it's folks who are needing to go to the doctor via telemedicine, which is a great opportunity. I was able to do one of those telemedicine appointments a couple of weeks ago. It was fabulous. Didn't have to leave my home. I did it by phone. And you also, folks can do online learning. So hopefully we'll see some changes in this. It's a great opportunity to improve the state of South Carolina just for more of an infrastructure status. And, we hopefully will do that. A big thing that folks need to be aware of is that we have a primary June the 9th. And last week when the General Assembly was in, the General Assembly, the House and the Senate, and the governor signed into law a provision where it will allow absentee balloting for the June 9th primary and the subsequent runoff. It's an easy steps to get an absentee ballot. You call your county elections commission. You can make the request for it either online or calling them. Fill out the application, and if the pandemic, I think it's excuse number 19 is the box you check. You mail it back in, and you will receive an absentee ballot. We know that older folks love to go and vote. They vote all the time. They vote often and always, as we say. And the Elections Commission and the state government is making this wants to make it a safe and secure election with the mail-in balloting. And also, in case you decide to go vote in person, you still have that option. But they are asking that you wear a face mask, bring your own pen to sign the ballot, and bring anything and follow social distancing. The poll workers, and a lot of folks probably on this call are poll workers who, and I know Richland County is looking for poll workers as well because of folks just not wanting to work, and I can understand that. But make sure that, take precautions if you do go in person and vote. But absentee voting is available for this election. And all this information, we've got a huge resource page on our web at aarp.org/SC with all our COVID resources ranging from recordings of meetings that we've had with federal officials, state officials, our fraud information, absentee voting. If you need to get in touch with DHEC or South Carolina Department of Employment and Workforce, if you're doing all those kind of things. So there are a lot of resources. And I think what really, as being a lifelong South Carolina resident, I think what this really has demonstrated is the true spirit of the state and how people have come together and worked hard to help folks who are really in need, because we've got a lot of folks who are hurting and in need, and we just want to be there to help these folks and be a part of it, be a part of the solution right now, and hope folks are staying safe and adhering to social distancing warnings. So, Tamara?
Thank you so much, Patrick. What a great overview. Lots of great information. And as you can imagine, we've got a lot of calls. A lot of people want to talk to the two of you. So we're going to take calls right now for Senior Resources and AARP South Carolina. So that's for Patrick and Andrew. We're going to start putting people through. If you would like to ask a question, if you have anything in your head or any comments that you'd like to ask or make a comment, press 0 on your telephone keypad right now, and you will be connected to a staff person who will put you in the queue. So let's go to our phone lines. Right now, I have Betty. She is calling about utility bills.
Hi, Betty. This is Patrick with AARP, and utilities is my beat and been a part of my life for the last couple of years. And one of the things, go ahead with your question, though, Betty.
Okay. My husband passed away in January, and I didn't have the money to keep up with everything, and my light bill got behind, and I have a 14-year custody of a 14-year-old. We've had her ever since she was 2, and I was calling to see if there was any help that I can get to get my bill caught back up where I can manage it.
Sure, and bless your heart for being a caregiver of a young child too, and I'm sure you're doing some schoolwork as well. Part of the CARES Act allotted money for utility bills, and if you remember, the governor issued a non-shut-off order from the investor-owned utilities in South Carolina, and some of the municipalities followed suit, where they couldn't turn your power off during the pandemic. That order expired May 1st, but we're in the process of investigating where those funds are, and they're coming through the LIHEAP program. And if there's a way that Tamara can get me your information, I'll be happy to follow up with you next week and see what we can do to help you out, because you've got to keep the lights on, got to keep the air conditioning going during the summer months. So there is money available for folks to pay those power bills.
Yes, sir.
And
thank you.
This is Andrew. I'm going to chime in on another piece there, Ms. Betty. There are programs available for grandparents who are raising grandchildren to get some help and some advice and some relief on things like back to school supplies. And I would encourage you to reach out to our local area agency on aging, which is Central Midlands Council of Governments. And they work directly with the Department on Aging to get some relief there for you as well, because you're doing an admirable thing raising a young person. And so I appreciate you doing that, and I want to make sure you've got those resources at your disposal as well.
Okay. Thank you so much, sir. And I need to call the resources. Hello?
You can give me
Yes,
a call.
ma'am.
We're going to pass information on our website. They'll have information and contact information for all the panelists tonight. So you'll be able to call them and ask your question or get more information.
Oh, wonderful, wonderful. Thank you.
Perfect. No problem. Thank you. And so next up, we have someone calling about emergency vouchers. So I think this is for you, Andrew. Brenda is calling and has a question about the emergency voucher program in the farmers market. Brenda?
Yes. Good afternoon, and thank you so much for this forum. This is so greatly needed. My name is Brenda McGriff, and I live in the 29210 area off of Broad River Road. The emergency voucher is a wonderful way of getting healthy foods to seniors, but we in this area got hit with a twofold because we don't have an adequate grocery store in the area within probably about a 7 or 8 mile radius. But the vouchers are for the fresh fruits and vegetables at the farmers market, which makes it even more of a task for seniors to try to get out there. And my question is, could you fine-tune that so that seniors in the area that can't get to the farmers market be able to use those vouchers in the local grocery stores?
Yes, ma'am, Ms. Brenda. That's a very valid point. I know there are certainly areas in our community that are food deserts, and you absolutely outlined one of the issues. And so I think that is a possibility. I will say these vouchers are good actually at local farmers markets, so you don't have to go all the way out to the state farmers market. There are Seeds of Hope farmers markets that usually pop up in church parking lots around the community. I know there's one typically over, I think, at Virginia Wingard United Methodist Church right up there in your zip code. That is a little bit of a moving target right now, as some of our traditional sites that operate in Richland County are not committing to having those open or when they will be open. But those vouchers will be accessible in every part of the county is the goal of Department of Social Services. And so they are still lining up exactly where those sites would be. But the vouchers will remain good through the fall. So as things open back up, hopefully you'll be able to find one close by that you'll be able to access that this year. And then as that program evolves in future years, hopefully we can expand that into grocery markets and other more accessible locations.
That would make it so much more accessible to those that are in a pinch in trying to get to grocery stores in this particular area and trying to find the farmers markets, which we have a few, but right now, as you said, they're closed down. So I really would appreciate it if you try and figure out a way to get those vouchers so that we can immediately start trying to use those in the grocery stores, because so many of the seniors, even with the high cost of food, their ends are not meeting, ends are nowhere even in a half circle for them. So the more access that they would have to that is readily and as soon as possible would really be a benefit to a lot of our seniors now, especially with this program closing out at the end of May. Thank you.
Thank you, Brenda. I appreciate that.
Andrew, for people who don't have computers or access to a computer, how do they get the vouchers? That's a question that just popped up on our list as well.
Yes, and so that is the number one question we are getting on that program right now. This is the first year that it has been electronic and not a paper copy, and part of that is because of the social distancing regulations that would need to be in place. So what we are first encouraging people to do is to find a family member to fill it out on your behalf, or a neighbor that can get on the DSS website and fill it out. It's a very brief survey. But see if you can find someone in your circle that can fill that out on your behalf, and that is the quickest, easiest way to accomplish that. Secondly, you can call the Department of Social Services. They have a hotline, and they are able to connect you, whether if you don't have internet access, or we've also had some folks who want to access the program who don't speak English and need multilingual support. Then Department of Social Services has a call center up in Greenville that can handle those requests as well. So really channel those through the Department of Social Services, and they'll be able to connect you.
You can also call the library's social workers. That number, we'll be posting that at the end of tonight's call. You can call the hotline, and they will get you information from our Richland Library social workers. They can help as well. Thank you so much. So we're going to shift a little bit, and we're going to shift gears and talk about what you can do to stay safe during this crisis. Let's hear from Sheriff Leon Lott. We are very fortunate to have Sheriff Lott on the call. Thank you so much for being here, Sheriff Lott.
Thank you, and I appreciate all the people that's listening and the partners that's on this phone also, that we're working very closely with them. Unfortunately, criminals didn't take the time off during the crisis, and they've continued to be out there full force. But fortunately for our citizens, with the schools being closed down, we had extra deputies. All of our school resource officers we were able to put on the street. And while our seniors are scared of the virus and catching the virus, we didn't want them to be scared of crime. So we have really flooded the neighborhoods and had a high visibility of our deputies out. Getting them out of the cars, talking to people, senior resources, helping give out food. So we're trying to get out in the community even more with all these additional officers that we've got. But, Patrick talked about the scams, and that's one of the biggest things we've seen with our seniors right now is the telephone scams. Not so much anybody coming to our house, but trying to scam our seniors with over the telephone. Some of them getting very aggressive, threatening our seniors that a deputy's going to come arrest them, that they owe money and they're from the IRS. And our advice for seniors, when they get phone calls, if you don't know who it is on the other end of the line, just hang up on them. They can't come through the telephone line and grab you, so just hang up. Nobody's legitimate government agency or law enforcement agency is going to call you on the phone and request personal information or your credit card number. They're just not going to do that. So it's simple. Just hang up. When that phone rings and you answer it and you don't know who it is, just hang up on them. And that's the same thing if somebody comes to your door and knocks on your door. You don't open your door to see who it is. You talk to them through the door. And if it's not somebody you know or somebody you've called to come to your house, then you never open your door. So you can protect yourself by doing that. But be aware that people are now going to the bad guys are going to try to take advantage of this situation. They're going to be calling. They're going to be aggressive, trying to scare you to give it personal information. Then they're also going to be the calls where they try to pull on your heartstrings. Organizations that they say they represent is here to help seniors, is here to help children that's suffering during this virus, and you need to donate money to these charities. If you don't know who that charity is and don't know who that person is, again, don't give them any information. If you want to give money out and everybody's Christians and want to help other people out, there's organizations like Senior Resources, your church, that you know where that money's going to go to. So don't fall victim of somebody pulling on your heartstrings. trying to get you to give money to something that just doesn't exist. The other thing that we've seen an increase in is where our seniors who drive, they come home, they leave their cars unlocked, and they'll leave something of value in the car. Unfortunately, some of our seniors like to leave an extra key in the car. Well, when the bad guys come along and your car door is unlocked, it makes it very easy just to go in your car, search it, they find the key, they steal your car. If you've left anything of value in the car and it's unlocked, they'll just take it. So our advice is to always keep your car locked. It doesn't matter if you're home, at the store, or at church. Always keep your car locked and never leave anything of value in the car, especially where it can be seen. Most of the time they will not break into a car to hope that they find something, but if they see something of value in there, they will go in it. But what we're seeing is people just not locking the doors. They're just leaving the doors unlocked. So help us out on that. We can prevent that crime by just keeping the doors locked and your valuables put away. But the biggest thing is with our seniors, just use common sense. We're all, we all have a brain. We have to use it and make sure that we don't get scammed. So be careful on who you talk to, and when you do go out, be careful. We ask you to always keep your doors locked. Try to avoid traveling at night. Our seniors now have special times in the mornings that they can go to different stores that are just for seniors. Take advantage of that. We ask our seniors, don't go shopping late at night. And we ask our seniors, if you don't have to go out, don't go out. Stay home. But if you do have to go out during the daytime when there's other people out that they can see you. So try to avoid going out at night. And then also our program we have at the Sheriff's Department for senior citizens, Project Hope, help our pressers elderly. We have retired police officers that will come and visit you. They will come to your house, make sure you're okay, tell you about the various scams that are going on, just check on you. We'll call you. We want to make sure that you're okay. So this is a free program through the Sheriff's Department where we'll come and call and make sure you're okay. If you need medicine picked up and you can't get to the doctor, we'll do that. Whatever we need to do to help our seniors be safe, but also know that somebody loves them at the Sheriff's Department. That's what Project Hope does. So this is a free service that we offer to all of our seniors in Richland County, and we just welcome. We have probably 700 seniors that we have right now that we check on. I'd love to have it 1,700. We'll add additional retired deputies to come check on you if need be. So we encourage people to be part of Project Hope. And I know Betty called earlier, and she's a grandmother that's raising a grandchild. If you need assistance from the Sheriff's Department, we can help you on that. There's things that we can do with school supplies. If there's issues that you're having with your teenager, we have our youth services that can help you out on that. So the biggest thing with seniors is don't be embarrassed to ask for help. Never be embarrassed to ask for help. We're always there. Your Sheriff's Department always welcomes you to call, ask for help, ask questions, whatever you need. We're going to respond to you. We're not going to think you're silly, and we're not going to think you're wasting our time, because you never do that. As a senior, you don't. We're there for you. So please use us. That's what we're there for. We're there to protect you.
Thank you so much, Sheriff Lott, for that. I was wondering, with essential services like your deputies, as well as folks that are medical professionals, EMTs, all of that, I wondered if you had changed anything in your office that makes it safer for your deputies to be on the road, because I can imagine that some seniors may have a little trepidation about if there's a problem out there in their neighborhood. They may be a little nervous to call because they don't want someone coming into their home. So have you thought about or found a way to address if anyone's feeling a little nervous about calling for help?
We have. We couldn't close up. The Sheriff's Department couldn't close up and work from home. We've had to have all of our deputies out there working. So they all have masks. They all have personal protection equipment. We've sanitized all of our vehicles. They have all the sanitizers, and they do that on a regular basis. We check our officers to make sure that they haven't been infected by the virus. So we check them and make sure that they're okay. Of the 900 employees that we have at the Sheriff's Department, we've only had one that's tested positive. So the things that we've been doing have worked. So I want all of our citizens, particularly our senior citizens, to know that when a deputy responds to you, they're safe. They're not infected with the virus. They're safe. We're taking care of them because we want to take care of you. And so we're doing everything we can to make sure that we keep these deputies on the road. And it's been successful so far. 1 out of 900, and he's fully recovered and already back to work. And I'll take that anytime.
That is impressive. Thank you so much, Sheriff Lott, for that. We're going to ask questions. We're going to ask for questions for Sheriff Lott a little bit later. But again, for those of you who are just joining us, my name is Tamara King, and I'm with Richland Library. And if you're listening to our town hall meeting where we're having an important discussion for seniors and caregivers 19 crisis, that's what we're having tonight. Lots of great information. If you would like to ask a question, press 0 on your telephone keypad now, and you will be connected. There are quite a few people waiting right now, so we're going to try to get to your questions as much as we can. And at the end, we will tell you how to leave a voicemail. Tonight, we're also fortunate to have a member from the medical community on the call to supply information about the latest updates about COVID. We've had tons of questions in the queue for DHEC. So Dr. Jonathan Kenoche, he's on the line from DHEC. Doctor, are you there?
Yes, I'm here. Good evening. Thanks for having me.
Thank you.
So
I'm sorry. As the community begins to reopen, there are tons of questions from seniors. They want to know how they can stay safe, how to keep their families safe. Lots of questions about masks and testing sites. So I'll let you address those. Thank you.
You're welcome. Yeah, thanks for having me this evening. The testing sites is something that we've really been working on a lot over the last 3 weeks, 4 weeks. The planning has really been going on for some time to increase testing across our state, and we've started to roll those sites out. In areas where it might be harder for people to access their testing sites or to go to a provider, it might be a little more difficult. So that's really been our focus and our aim right now. So, while some people in larger cities might be able to go to a major medical institution or major medical center for testing, it's much more difficult for people who live in rural communities. So that's something that we've done. And if you go to our website, scdhec.gov /COVID-19, there's a link there to click on that has the testing sites that are available. So you can search it by county. It'll tell you which options are available and what their hours are and their address. There's also some links there for telehealth options through some of the major medical systems or healthcare systems across our state that people can avail themselves of as well. And most of them are providing free consultation services to be evaluated by a provider, and then if testing is warranted, then to go to appropriate facility to go be tested. So that's really been one of our main goals. And the amount of testing has really increased quite significantly, even in just the last 2 weeks. If you were to look back maybe a month ago, we were testing somewhere around 1,500 people a day on average. There was some variation there, but with all of our increased efforts and our partners' efforts across the state and the private sector, we're closer to 2 or 3 times that level on a daily basis. So we're getting a much better snapshot and understanding of what's going on with the disease across the state. And we haven't had our highest number, our highest peak was back the week of April 11th. So the numbers have kind of gone down or plateaued from there. I think a lot of people have been looking at whether or not we're seeing a steady decline, and I would say we're sort of holding steady, and I think that's in part because of all the extra testing that we're doing. So we're detecting more of those cases that we knew were out there, but didn't know necessarily who they all were. We couldn't identify them all. So by increasing the number of tests that we're doing, we're able to better identify where the disease is and how we can contain it and put people in quarantine or isolation to help control the spread across the community. So I think that's been quite successful, and we're happy with the efforts that we've and the things that we've achieved with our increased efforts on that front. I do think that the other thing that we're quite proud of is the amount of testing we're doing in nursing homes. So the agency has been testing every single resident, every single employee, every single staff member at nursing homes across the state, and our goal is to have that completed by the end of this month. So that's a pretty big undertaking. You can imagine across the entire state how many tens of thousands of people that is, because that's the group that we're most concerned about. And not just in South Carolina, but across the U.S., the elderly population has been the most impacted and negatively impacted and having the highest rates of morbidity and mortality. So that's why we're doing our best to see who might be infected but not symptomatic, and what can we do to help control the spread in those environments. So those are some of the major efforts and things we've been working on as far as testing goes across the state. And I think the other important thing, to remember and keep in mind is we don't have a vaccine at this time. We don't have a tried and true treatment option. So the most important thing that we can do as a community and as family members, thinking about, those who are more vulnerable among us, whether it's our grandparents or parents or people with compromised immune systems, is that we need to do our part and wash our hands and stay away from folks and practice physical distancing, wearing face masks when we're out in public, not going to visit friends or family or others, going to work when we're not well or when we're feeling sick, and going to be evaluated to see what might be going on. So those are kind of the basic highlights of what I wanted to touch on this evening. I know there's lots of questions. I'm more than happy to talk and answer questions that people might have.
Yes, you're very popular. All of our panelists are very popular, so that means there's a real value to what you guys are doing tonight, and we appreciate that. I have a call from Margaret. She wants to know about face masks and gloves, and there's a lot of questions about how do we get those face masks and how do we get those gloves. I'll let Margaret ask her question. Margaret?
Yes.
Are you there?
I was engaged in the first serving of the meals at the Southeast Library on Garners Ferry Road, and all we had to do was pull up and sign our name, and they had the bag, the food already prepared, and we just pulled out. So it went really smoothly. But the problem that I'm having, and I'm hearing from other friends of mine who are seniors like myself, is that we can't go out searching all over town from one end of the county to the other, trying to find face masks and gloves. And a lot of us can't afford these really high-tech ones that are online to purchase, and then there's a delay in getting it. Even if you can afford to order it online, you have to wait to get it. I have run out of gloves and masks, and I was wondering whether or not it would be possible, like they did at the library for the meals, that I know that there's some faith-based distributions taking place, but transportation, as was mentioned before, is a problem for seniors to get there to receive certain services. So I was wondering whether or not it could be implemented in the same fashion as the meals that were distributed to seniors pull up and get a supply of gloves to get them through maybe a week or a couple of weeks, and mask, and even if we have to pay for it, some of us can afford it and some of us can't. But I, for one, I can afford to purchase if it's readily available immediately, and that was one of my questions. Yeah,
that's a great question, Margaret. Thank you. And there's been a lot of interest and concern about people being able to get the appropriate personal protective equipment that they need. And I think the priority group for us right now as a state is making sure that healthcare workers and workers that might be working in a nursing home or long-term care facility or taking care of people in a medical setting, that they have ample supply. Because we're even hearing from some healthcare facilities and things like that they were not able to get the necessary gowns or face masks or eye protection that they needed. And so we do have a strategic stockpile. We do have emergency stockpiles to help make sure that the healthcare personnel that need them the most are able to get them. I personally don't have any gloves that I'm using when I'm going out in public. I think in part because the supply is limited, and I personally just think the most effective thing that you can do, and I think that my colleagues would recommend that you do, is to wash your hands well. Wearing a glove for it might be a short time, but it's not necessarily maybe the most strategic. I guess I think the more important thing is to wash your hands well, whatever you might be touching. And I think a similar thing, I could say about the face mask as well. And I think that's why you've seen the CDC and DHEC put out information about cloth face masks and how you can make one and how you put that on, so whether it's a scarf or a bandana or you get some kind of form to cut one or sew one. That's what we're recommending. And that's really just, when you wear that, that's to protect other people from yourself, from people around you. So it's not necessarily that you wear a face mask and you're being protected from other people is that you're protecting others from whatever you might cough or whatever you might sneeze out. So that's the rationale behind the face masks, and that's why we're encouraging people to use cloth face masks as much as they can when they're out in public.
Yeah, I'm following all those procedures already. When I ran out of the face mask that I had on supply in my house, I use a kerchief, bandanas, I guess what you would call them, and the hand washing procedure. That's always been the case with me anyway, because my former profession was in the healthcare field, so I know that. Yeah. Yeah, you got it. That's exactly what we recommend. That's what we recommend for the general public.
Thank you so much for that. Doctor, I was wondering, there was a conversation recently, an article that came up, and there's a lot of talk about viruses living on the surfaces. Some people say it's not as much as we thought, or you can't get it that way, or you can't, get COVID-19 by touching surfaces. I was wondering, from a medical professional, your standpoint on how we can safeguard ourselves when we go to the grocery store, when we do have to go out into the world now that it's reopening, our state is reopening. I know you gave some tips, just want a little bit more, just a little, if you could talk about that.
Yeah, that's an excellent question.
What time is that?
Sorry.
I'm going to call Tracy if she's around. Okay.
Yes. The primary method or mode of transmission is from coughing or sneezing, what we call droplets. So
Palmer Garrison's house.
Somebody might be breathing or coughing or sneezing around you.
House.
That's the primary way, but it can live on surfaces. You're right. So that's part of the reason why following good hand hygiene is important. So for example, I and my family, we keep hand sanitizer in our car. So when we're out at a convenience store or at a grocery store and we go, shopping, we're picking up our items. During that time, we're very mindful that we're not touching our face. You'd be surprised how often people touch their face when they're shopping or just in general. So avoid touching your mouth or your eyes or your nose while you're shopping. And then once you get back to your car, if you got some hand sanitizer there, you can go ahead and wash your hands right away with some hand sanitizer, some alcohol-based hand sanitizer. Or if you don't, when you get home, just old-fashioned soap and water is equally effective. I know a number of grocery stores have offered senior hours, and I think if that's around you, you should avail yourself of that opportunity just to avoid a number of crowds. I know a number of them where I live have early hours for senior citizens to go and do some shopping to avoid the crowds and make sure that, it's as clean of an environment as it can be. I think stores and grocery stores included are being really mindful about washing their surfaces well after each day or just even during the course of the day multiple times. So walking down counters and doorknobs and putting up shields where the cashier might be. So I think people are doing their part. I just think it's, on us to be mindful and responsible about what we're touching and then, washing our hands well and not touching something.
Thank you for that. Thank you for that, Dr. Kenoche. Again, for those of you joining us, my name is Tamara King, and I'm with Richland Library, and you are listening to a town hall meeting. We're having an important discussion for seniors and their caregivers during the COVID-19 crisis. If you would like to ask a question for any of our panelists, press 0 on your telephone keypad now, and you will be connected. So we're going to go to the phone lines again. I have someone named Joyce. She's been waiting a long time to ask questions about test results and the testing sites in South Carolina. Joyce, are you there?
Yes, thank you. Yes, my neighbors and I were tested for the virus on Thursday, May 7th at Rice Creek School on Hardscrabble Road, and we were part of a 3-day testing of zip codes 29229 and 29223. We were told we would be called in 3 days, up to 3 days, and that's 2 weeks ago. I still haven't heard anything.
I'm sorry to hear that. I'm not exactly sure if that was who performed the testing. There are a number of different groups that are testing. So, there are some that are sponsored or done by private healthcare institutions or private laboratories, and their turnaround times can vary. A 2-week time period is much longer than usual. If it was done by DHEC, it usually takes 2 or 3 days to get results. And private labs are maybe anywhere from 3 to 7 days, depending on their number of tests they need to run or where they might be shipping it. So that length of time is a bit surprising to me. So I'm not quite sure who is running the test site, where you went, or which laboratory might have been running that test. But I don't know if there's a way maybe for whoever's running the call to get your contact information. They can share it with me. I can help look into that for you.
Okay.
Tamara, that was MUSC that ran that at Rice Creek. MUSC put that one on.
Yes, I'd recommend checking with MUSC on that.
And we'll have contact information for all of our panelists, so if there are any additional questions. There are lots of you asking questions, and I just want to let you know we only have like 10 more minutes on the call, so I'm going to try to get to as many people as I can. There's some musical questions from about the library and when we're going to open, and we are fortunate to have our executive director. She's on the call as well. So we'll get to that in a minute, but I have someone who has a question for the Sheriff's Department. She has a question about AT&T, and she wants to make sure that they're really AT&T that's walking around her neighborhood and asking questions. Pamela, are you on the line?
Yes. Can you hear me?
I can. Thank you.
Yes, but this one wasn't for the sheriff. It was for the doctor.
Okay, well, ask your question. I'm sorry, I was reading my notes. I apologize.
Yes, and I'm just, he can give me maybe some kind of answer. I had symptoms all of last week. To me, was the virus, and so I went to my doctor and I was tested Thursday, and was in quarantine for 4 days, and it came back negative. But I was also given an inhaler and antibiotics. And I'm just wondering, because I felt like everything I had was the virus. I just need some clarity on it.
Yeah, that's a great question. I guess I would refer, if there are specific questions that you have about your particular clinical course, I'd refer you back to your primary care provider. But if a PCR-based test was done, that's our gold standard for COVID-19, and I would trust that result. I'm not sure exactly which testing modality they chose to run. But if it was negative, I would trust that test result, and I would look for a different alternative diagnosis, which sounds like they may have done, but I would point you back to your primary doctor with that question.
Thank you.
Thank you so much, Dr. Kenoche. But for the sheriff, if you're still on, there was a question about AT&T. There's someone in the neighborhood asking about lowering bills, and the caller wanted to know, is this legitimate, or have you heard about any scams involving AT&T going door to door?
I have not heard about anybody from AT&T going door to door. So if someone is doing that, then I encourage you to call the Sheriff's Department or the local police department and let us come out and check them out, because that's not something that I'd say right now is legitimate. So we need to make sure we check and make sure they're legitimate. So please call us. If you ever have any doubt about anybody in your neighborhood going door to door, one, don't talk to them unless you do it through the door, but call the Sheriff's Department or your police department. Let us come out there and check them out, make sure that they're legitimate.
Thank you for that, Sheriff. Melanie Huggins is on the call as well. She's the executive director at Richland Library, and we've got a few questions for the library, and I would like for her to jump on and answer a few of those questions. There's a woman named Kim who wants to know when we will be opening our library, and saying the seniors depend on our services so much, which is lovely to hear. Melanie?
Exactly.
Yes. Hey, Tamara. Hey, Kim.
Hi, how are you?
I'm great. How are you?
You guys are awesome, to say the least. Even though we're all going through book withdrawal and everything else, we want severe
yes,
book
ma'am.
withdrawal, to say the least. We want to know when the libraries are going to be back open.
Yes, ma'am. So, we miss you guys so much. We love the connections we have with all of our customers, and we miss seeing your faces and in person. We have been working over the last week to get our library trained on CDC and OSHA standards, and making sure that when we do reopen, we are following all the protocols to keep our staff safe, to keep our customers safe. We are inching closer to it. The first set of services we will put into play when we do open is curbside pickup. So you'll be able to place holds at some point and come drive up just like you would at a restaurant and us put the books in your car for you. So we are working towards that as hard as we can, but our first priority is making sure that all 400 of our staff members, all 13 of our locations can follow CDC guidelines on cleanliness, on sanitation, making sure we have enough staff to open safely. But we are working towards it, and we cannot wait to see you guys again.
Do we have any indication of when at all?
No, you and all 400 of my staff have the same question. They're all so no. But what we're waiting for, honestly, not to joke about this, but what we're waiting for is to make sure that we have a sustained reduction in cases in Richland County. We have several criteria that we are looking for before we reopen, and that is one of them. And I'm glad we have DHEC on the phone because we haven't had that as of yet. We're inching towards it. I'm not a public health expert, but we're watching it and consulting public health. So we are inching towards it. We want to make sure that we are headed in the right directions in terms of new cases before we reopen and put anyone, our staff or customers, in any kind of harm's way.
Okay, and I have one other question. Are we going to be able to call our respective branches and reserve books?
Yes, that's one of the first things that we will reinstate. So when we closed our branches in March, we had over 3,000 items on the shelves of holds waiting to be picked up. And so we are, first we'll call those folks and say, hey, come back and get your holds. And then very shortly after that, we will say, put new holds on. We're ready to fill those for you.
Well, are you going to be putting that on so can we start calling the branches now to start reserving books, or? You
cannot reserve branches yet, and we don't want you to bring the things back that you have. Just keep those. Our book drops are not open. But as soon as that is ready to go, Tamara and her team will make it widely known on radio, television. We will post it on our website. We will send an email blast out to all of our current customers who we have their email addresses and let them know that we're back in action.
Thank you so much, Melanie. This has been an informative discussion. Our thanks to each of our panelists for answering those tough questions and pivotal questions tonight and providing vital information. And again, thank you all for joining us tonight. We've had a great discussion. If you have a question that was not addressed during tonight's call, please visit www.richlandlibrary.com for more on panelists tonight and their contact information. That should be posted in the morning. Also, please note a recording of this phone call and this meeting will be posted on the library's social media channels and on our website tomorrow. So you'll be able to get access to it and share it with your friends and family who weren't able to get on the call. Thank you again. We hope you found this helpful. This has been a wonderful hour for us. We wanted to make sure that we empowered our senior citizens as much as possible with information during this pandemic. This concludes our call. If you have additional questions or concerns, like I said, please stay on the line to leave a voicemail and someone will call you back. Stay healthy and safe. Thank you.